क्या आपको नेवल एरिया में स्वेलिंग है या दर्द हो रहा है?
Master Health Checkup has become a scam. I was shocked to see more than 100 tests were done to my friend in his Master Health Checkup.
कॉमन मिस्टेक्स जो हम कर रहे हैं अपने बच्चे को सॉलिड्स इंट्रोड्यूस करते हुए.
What you saw on your screens were not just influencers but healthcare professionals stepping into the role of influencers. Hello and welcome to ThePrint. I am Ranalini, and now, as you saw on your screens, healthcare professionals are leveraging platforms like Facebook, X and Instagram to share vital health information. From sexual health and gut health to pediatrics, liver care and daily wellness tips, these medical experts are now health influencers. Their goal is to disseminate knowledge in an accessible and engaging way, bridging the gap between complex medical jargon and everyday understanding. The content often features innovative approaches such as using humor, interactive games, or storytelling to connect with a larger audience.
It takes at least like 1 hour, it takes at least, with the experience what I have right now, it takes 2 to 3 hours to create a 1-minute video. It takes 2 to 3 hours to create a 1-minute. The reason is, we do the script. We need to find out what is the exact delivery angle that we are trying to bring in. What is the comical angle that we're trying to bring in? I write so many jokes with a single video, and then I have a team that I discuss and brainstorm. And I don't put all the jokes. I just put the joke that works to me at that time. So I keep on practicing the delivery. And for other people, it was just like a simple shoot. They just give the information, they are done. It's not like that for me. I need to modulate. I need to raise the voice, deliver it properly, and then expression. Everything comes along with it. So it takes a lot of time.
That was Dr. Manickam, an American board-certified gastroenterologist who has a large following on all social media platforms. I spoke to other practicing medical professionals turned influencers who said how the prevalence of misinformation fueled by random Google searches and misleading social media posts, which led to widespread misconception and improper treatments, in turn made them take to social media. They are determined to provide accurate, science-backed information and empower people to make informed health decisions.
A lot of the patients that I was seeing when I started my practice as a junior consultant in 2016 was that lot of these diseases and lot of the problems that patients were actually coming to me with were preventable or avoidable. And I was sitting there telling them that, this could have been avoided or this could have been prevented if you followed A, B, C, D like that. But then ultimately, I kept seeing such patients throughout my initial months of work. And some of them were actually in quite bad shape. So the whole aspect of going beyond the outpatient to educate patients, the public, their families, started when I started seeing people falling for misinformation with regards to alternative medicine, especially. That's where the whole issue started, the challenge, I would call it. And I was treating them, and some were getting better, some underwent transplant, some of them died. And ultimately, the only way that I knew that this can be prevented is not by treating more and more patients, but actually telling people that, these things can be avoided. What is beneficial for you, what is not beneficial for you.
And that's how the liver doc, as we know him, came into being. But for a few, it was also about preventative care.
So my motto was that, put medical content and mostly preventive. I don't discuss, if somebody gets a disease, what treatment. That is known to all doctors. And anyway, we cannot give medical advice on social media. Once somebody becomes a patient, they have to visit a doctor or hospital. So even somebody is not a patient, what are the things one can do to, avoid becoming a patient, and maybe pick up the disease in the early stage where something without medicines and something without surgery, they can be helped.
Sometimes people just Google and they put anything and it shows all the things which can happen to them. So if they are educating themselves about any particular disease or as such any health concern, then they can be assured about certain things that, okay, this is alarming, this is not alarming. So that could really help them make more informed choice about when to visit a hospital.
As I mentioned before, these are practicing medical professionals. So how do they balance their medical practice with content creation? Guess what? Most of them have a team of at least 3 to 4 people managing their content.
I do have a team to edit because see, as a healthcare professional, as a doctor, I can't edit and post and all those things. I obviously the shooting and the scripting and the planning of the content is not done by anybody for me.
If you ask about how am I managing my content, I have a content manager who does that for me and who keeps giving me suggestions that, okay, this is the way you should speak about this topic, and this topic could be covered in the podcast. We could have short reads, because this is how nowadays people are consuming content. So the way people can consume content is the way you have to present it.
Well, there are a few like Dr. Madhavi Bharadwaj who fly solo. She's a one-woman team. She goes by the username of Bachon Ki Doctor, and her content is mostly about child healthcare and parenting. She has a reach of at least 1.4 million on Instagram and a viewership in lakhs on YouTube.
I do edit myself. I tried taking help from other people, but medical content is as such, I'll have to sit along. भाई ये गलत word edit कर दिया, ये तो आना ही चाहिए, है ना? ये तो मतलब नहीं बना रहा है, तूने क्या edit कर दिया? So I realized कि not even my husband can do it for me, क्योंकि he's not a pediatrician. He's not me. तो जो मेरे को editing करनी होती है वो कोई और करेगा तो भी मुझे redo करना पड़ता है. So I would rather do it myself. So yes, I edit myself. और क्या करना होता है, डालती भी मैं ही हूँ. सिर्फ एक चीज जो मैं नहीं कर पाती हूँ, दैट इज आई टेक हेल्प अबाउट सीइंग डीएम्स. इतने सारे आते हैं, आई डोंट लाइक कि कोई मैसेज कर रहा है और उसको कोई जवाब नहीं मिले. वो मुझे अच्छा नहीं लगता, क्योंकि जो भी मेरे से जुड़ रहा है वो एक कनेक्शन बनता है, तब वो मुझे मैसेज करते हैं. तो बहुत ही पर्सनल मैसेज भी आते हैं कई बार ना, कोई बहुत परेशान है और मेरे को मैसेज कर रहा है एंड दे वुड जस्ट नॉट रिसीव क्या बोलते हैं मैसेज बैक, या उनका इनवाइट एक्सेप्ट नहीं हुआ है. वो थोड़ा मुझे खराब लगता है. तो आई स्टार्टेड टेकिंग हेल्प ऑफ मेरा एक स्टाफ, मेरी 2 स्टाफ हैं, तो आई टेक देयर हेल्प. बाकी सब खुद करना पड़ता है.
For most of these health professionals, when they began their journey on social media, the aim was not to earn money out of the content but to spread awareness. But now, with the immense following and reach, many of them have been able to monetize their content, sometimes directly and indirectly through patient flow and workshops.
So I did monetize it right away. So I did not hesitate at all, because I run a charity in Madurai, in Tamil Nadu. So it is a charity for hospice patients and also for people with special needs, kids with special needs. It's a free school. And it's also a free nursing home. So the AdSense revenue usually goes to that. There is nothing more for us. And the revenue is also depending upon where the audience is watching you. I don't get anything from Instagram. Instagram is zero. Nothing. I don't get anything. The YouTube I do get, but it is based on the audience where they are watching from. So for the same amount of following what I have, if it is a US doctor with a US audience, they will earn more than what I'm earning in my gastroenterology practice. But because it's in India, the revenue per minute is much, much low. Based on the Google standards.
When I looked at my YouTube studio channel just now, I mean, I just saw that I had $90 monetization on it. So for me, monetization is not the whole aspect of it. So I think I want to play the devil's advocate here on this.
Please.
Yeah. So I mean, definitely my content out there, podcasts, interviews, everything has helped me attract a lot of patients. Some of them come even from far places. I mean, I have had patients coming from Kashmir to see me, because I don't have telemedicine facility for new patients. I just see patients on a referral basis in my outpatient. So they actually book tickets and they come and see me from Kashmir also. But what is happening here is that a lot of these patients who come to me for treatment, they require only primary care. So it's just basic level of advice, exercise, diet, etc. For that, they are coming all the way to me. And as a hepatologist, as a subspecialist, I should not be seeing these patients. So basically, for me, it's actual referred patients losing their chance to meet me at that time, and primary care patients taking their space there, where a general practitioner or a family physician should be taking care of them. So I'm losing out on quality patients at some point when I get to see primary care. But I'm not complaining. I help everybody who comes to me for help, and I treat them whenever I get the opportunity.
We live in an age of social media where anybody can access and create content. All you need is a mobile device and an internet connection. And these health professionals admit that there is a flip side to this content creation when it comes to social media.
I think, see, basically, as I told, we need to, be updated, because if I just keep putting content without actually knowing the stuff, saying that, okay, I am the, doctors, I am the god of all information. If I do that, it is not correct, and I may be wrong many times. So it is like almost like teaching, when we are teachers, because we do teach medical students, postgraduate students. So when we teach, we also have to read. I cannot just go for a class and start talking. So I should know the latest in that field.
तो प्रॉब्लम ये होती है, आई हैव टू चूज माय वर्ड्स वेरी वाइजली. मतलब सी, मेडिकल साइंस इज नॉट ब्लैक एंड वाइट. there are shades of gray. If I give one advice to a particular set of mother and child, या एक बच्चे को मैंने कुछ एडवाइस किया, हो सकता है बिल्कुल उसका ऑपोजिट एडवाइस मुझे दूसरे बच्चे को करना पड़े. तो जब मैं सोशल मीडिया पे कोई भी मैसेज देती हूँ, या आई सी अ लॉट ऑफ रील्स आल्सो फॉरवर्डेड टू मी कि मैम ये भी ऐसा होता है क्या, वैसा होता है क्या, हो सकता है उस डॉक्टर ने या मैंने किसी एक इंटेंशन से वो वीडियो बनाया, बट इट माइट नॉट बी एप्लीकेबल टू एवरीबडी. तो सोशल मीडिया इज द प्लेस टू रेज अवेयरनेस, but it can never be a replacement to your hospital visits or a final verdict from your own doctor.